Hello, everyone, and welcome to this audio podcast. This audio podcast as part of this, as part of this series in the Spectro integer. This audio podcast as part of the Chromulin series. This audio podcast series as part of a Storm Robotics production. In this audio podcast today, looking at an intro or introduction as part of looking at looking at hematuria. So the source of and reason for hematuria is often confused due to the lack of clarity over the description, analysis, and patient referral criteria. Right, referral criteria. A thorough hematuria review have been carried out, and as a result, the Renal Association and the British Association for Urological Surgeons formed the joint working consensus to a joint working consensus on guidelines to update training of staff providing care for patients with hematuria. Urinary screening for hematuria should only be performed for recognizable medical reasons, as there is presently, or as there has been, there's presently and has been sort of little or no evidence to support opportunistic point of care testing or POCT for the general population. The nephrological or the kidney aspects of analysis and the control have been covered in and by the National Institute for Health and Care Excellence and Chronic Kidney Disease or CKD guidelines, which had replaced the former UK Royal College of Physicians CKD Chronic Kidney Disease framework. So this in the original publication from 2015, looking at hematuria and testing to improve patient outcome. The the it, the publication looked to offer a general overview, if you like, of hematuria and sort of background information and sort of definitions in context of chronic kidney disease, and from a primary care perspective, it is perhaps also important that the scientists can also appreciate or a general practitioner curriculum, if you like, on hematuria and on the general practitioner curriculum on hematuria. At the same time, hematuria is defined as the presence of red blood cells or RBCs in voided urine, either visible, being macroscopic hematuria as detected by direct microscopy, or detected by a direct microscopy and referred as microscopic hematuria. Substantiated numbers of red blood cells or RBCs have provided ranges used for a classification of microscopic or occult hematuria, with established definitions using values of more than 3 red blood cells RBCs per high power field, and more than 5 red blood cells or RBCs per high power field also. Hematuria can also can be broadly classified as sort of nephrological or urological in origin. Any glomerular disease or condition may result in microscopic hematuria and active glomerular nephritis and acute interstitial nephritis are also associated with large numbers of usually dysmorphic red blood cells and red blood cell casts. Other reasons for hematuria also include a non-visible hematuria, 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 which is where in amongst the literature is referred to as SNVH, or S being S being basis in symptomatic being where the S being as part of the abbreviation is in regard to symptomatic non-visible hematuria, which is also connected to the lower urinary tract, and this can include a reluctance to void and voiding frequency and voiding desperation or painful voiding voiding dysuria. And secondly, asymptomatic non-visible hematuria, or ANVH, asymptomatic non-visible hematuria, which is an incidental finding in the absence of lower or upper upper urinary tract symptoms. Microscopic hematuria may also be detected in the presence of any underlying pathology, such as after vigorous vigorous activity. So that draws this audio podcast intro to a close. This intro as part of the Chromulin series. This audio podcast as part of a Spectro integer. This audio podcast introduction as part of a Storm Logistics production.